If you've ever spent a night with a child who has an ear infection, you know those hours tick by pretty slowly as you wait to see a doctor in the morning and get a prescription. But soon that may not be necessary, thanks to some proposed healthcare changes in Ontario revealed today by the Premier. Michelle Chung joins us live with the details.
Well, if the provincial government has its way, you'll be able to walk into a pharmacy like this one and you'll be able to renew your prescription without actually going to see the doctor first. That's just one of the changes that the McGuinty government is trying to push through. Physiotherapist Adam Brown says it could take 10 days to get a doctor to order diagnostic tests. He says he could do it himself much faster.
We see a lot of people who don't have family doctors, and this helps them to be able to access x-rays or diagnostic ultrasound a little bit quicker than having to go through a walk-in clinic.
The Premier says he's committed to speeding things up.
Instead of waiting in the emergency room to see a physician, you could have your fracture set by a trained nurse practitioner. If you need your inhaler refilled, the pharmacist could do that for you in one trip instead of two. One to the doctor and then one to the pharmacist.
Under the proposed changes, pharmacists will be able to prescribe drugs. Nurse practitioners, dentists, and dental hygienists would dispense, mix, and sell drugs. Midwives will be able to take blood, and physiotherapists could order x-rays and ultrasounds. Nick Davies says this would make it easier to get the help he needs.
It's definitely going to be a bit of a pain to have to get that recommendation, go to my doctor, which can be difficult. I mean, doctors are busy.
I have one medication that's a repeat, and I have to call the doctor to have him repeat that, whereas if it's an ongoing repeat, the pharmacist should be able to do that.
But the Registered Nurses Association says nurse practitioners should be allowed to do more.
They should be prescribing openly based on their expertise, and they should be able to admit and discharge patients in hospital settings. Otherwise, the public will continue to experience delays in access to health services.
The Physiotherapist Association and the Pharmacists Association both welcome the proposed changes, but one pharmacist I spoke to did say that he had some concerns. One of them is the added workload. The other is the added liability of prescribing drugs, and he's hoping that those will all be answered within the next few months before that bill becomes law.